And we're very glad to have you on the program, and so great to be with you and teach you about health, wellness, and alternative medicine today. Again, I'm Dr. Z, Dr. Eugene Zamprone, naturopathic physician, just celebrating my 30th year after I graduated as a naturopathic doctor and helped found the College of Naturopathic Medicine in Bridgeport, where I teach naturopathic history and philosophy and rheumatology and some herbal medicine classes. And we're always here to help you stay healthy with this program here with the Natural Nurse. She has the day off today, and we have an illustrious guest on, one of my colleagues who I don't have the privilege of knowing, Dr. Devin Miles. And she's also a naturopathic doctor out in Houston, Texas, so we're going to introduce her in a second. But you can always get more information about our programs and fun shops and things that myself and the Natural Nurse are doing by going to our websites. That's drznaturally.com and, of course, the naturalnurse.com. So without further ado, let's introduce Dr. Miles. So she does a lot of work with using a lot of more nature cure things, which is really exciting. Maybe she could explain that later on. Because, the different schools of naturopathic medicine across the country, they kind of emphasize different things, and based on, of course, the licensing scope of the state that you're in and what you can do. And so nature cure is like one of these things that goes way back into the history of naturopathic medicine, but a lot of naturopathic physicians are kind of abandoning these types of things and picking up the prescription pad, which, I have my own thoughts about, which we'll talk about maybe. But she's a graduate of the Southwest College of Naturopathic Medicine, which is a wonderful 4-year curriculum which trains naturopathic physicians in blending both conventional and natural medicine. And she actually had her own health challenges at the time, and I'm sure naturopathic medicine helped her and her family and other people, and then she wanted to do the same for others, so she became a naturopathic physician, where she works with clients helping with digestion, mood, energy, blood pressure, all the Western diseases that we'll talk about in a bit, and particularly kidney function, which is something that she is focusing a lot of energy on. And she's the owner of It's Time Natural Health, and is available, for visits and things like that. So without further ado, welcome, colleague, Dr. Devin Miles. How are you?
I'm doing good. How are you?
Great today. I'm so
Good.
excited to have a naturopathic doctor on. We have a lot of great guests here on the show, but, it's nice to have a naturopathic physician so we could kind of explain the difference between ourselves and like what we call a green allopath, or an integrative allopath, or a functional medicine allopath. I'm actually using the word allopath. People don't even probably know what that is. So from your perspective, tell us how you got into naturopathic medicine, and then we'll talk a little philosophy for a while.
Sure. So I started having digestive issues at 21 years old. And it seemingly came out of the blue. I mean, it wasn't like I was stressed on the day that it started. I had a job in hand. It was my senior year of college, springtime. I was just hanging out and just finishing up my classes. And I just started having this bloating, and then it was constipation, and then more bloating, more constipation, then gas, then more gas, and then started noticing one food sensitivity after another, and different symptoms, just more and more. So I moved to New York, where that was my first job was in finance, and finally got to the doctor some months later, and was diagnosed. Well, actually, I didn't get the diagnosis just yet, but they did colonoscopies, endoscopies, didn't find much wrong. So fast forward, I saw a second gastroenterologist, and he was the one who diagnosed me with irritable bowel syndrome. So at the time, there was no cure, and we got the words in terms of where this comes from. We got the words I don't know, which I can respect the words I don't know. I'd rather you tell me you don't know versus say something that's just random and not true. So I it still was hard for me to hear those words, of course. I mean, I'm 21 years old and I don't and this is my first time dealing with something like that where it's just something new that I've never heard of. But anyway, on my block there happened to be a health food store, and I walked in and spoke with the owner, who happened to also have had IBS, and so he was able to resolve his through natural medicine. So that was the beginning of me diving into natural medicine. Didn't at the time think I was going to go into it, but over time I started to notice that I had an interest in this, and I liked when I would give suggestions to friends and family and they would use them. And it really it was the first time in a long time that I really was reading something outside of work, outside of school, and I was enjoying what I was learning. So I was looking around, and eventually I found naturopathic medicine, and I saw something that was very comprehensive. And that was something that I needed. I needed something that was very comprehensive for myself. So when I saw that, I was like, yep, that's it. That's what I want to do. So I left New York and made it over to Arizona to go to naturopathic school.
Wow, why didn't you come to our school in Bridgeport?
I know, right? Well,
Anyway, I would have been one of your professors probably
oh, really?
if you
Yeah.
graduated. Yeah, because I helped start the program and work with Dr. Sensenig, and I teach
Hmm.
history and philosophy there. And anyway, but it's so glad that you made that journey and took a hard program. It's a tough program because not only are you studying all the ologies that a medical doctor or osteopath has to study, but then you also have to study some of these modalities that we use and other sciences. Like I always tell folks that naturopathic doctors are the only doctors that actually take board certification in herbal medicine. In other words, it's on our national boards. There's no other profession that's like that. Tell us a little bit
Hmm.
about your the trials and tribulations of going to a very intensive 4-year program, medical school, basically, it is for naturopathic physicians.
So yeah, I could definitely tell anyone listening it is no walk in the park, and you find that out very quickly in the first quarter of school. So we go by quarters, we don't go by semesters. So we have 3 months on, 3 and 2 weeks off, and I could tell you those 2 weeks are needed every single time. Um, First quarter was a lot. It was intense, but it was really interesting at the same time. But of course, I walked in there with a condition, and the amount of stress that med school can place on you, you're thinking you're going in everything's about to be better, but really, if you're not careful, it can get worse just because it's just so much stress. You don't have a lot of time. And so, in some ways, I got better, in some ways, I got worse. What I did start experiencing was the symptoms of low adrenal function. And that started probably in my third year of school. My second year was very, very difficult for me. And I was just tired after that. So I started experiencing insomnia, um, hypoglycemic episodes, which I could tell were from the low adrenal function. It's just very, very tired. So my challenges really were that, just certain subjects challenged me. So I had to, of course, go to get some tutoring in those, and I made it through. But, the I had a colleague in class with me that we had become friends from year one, and we always said, we're only doing this once. We're only doing this once. So in other words, we were not failing. We
Right.
did not actually at our school, we did not have the chance to fail and then just continue. If you failed a course, you were out for a year. So that was very big incentive for us to do everything we needed to do to keep going.
Same thing in Bridgeport, definitely. So,
Yeah.
so anyway, so you graduated and then you're practicing in Houston, Texas. Let's talk a little bit about what is naturopathic medicine in your perspective? Because we have a unique philosophy. We're just not people that like, for like mental illness, substitute St. John's wort for Prozac. There's a whole understanding of where illness comes from and healing hierarchies that happen that sort of differentiate us, I think, from many practitioners.
Yeah, what I would say that comes out of naturopathic medicine is a way of thinking.
Mm.
And that way of thinking, I am very, very grateful for because I don't consider myself confined in how I think. I have a standard, a foundation, but through that, I know how to expand. And because of my foundation, I know how to connect things that I learn to what I already know. Um, and I'm willing to look at it. I think that's the thing. I have flexibility in terms of how I learn and how I can piece things together to fit better within the things that I already do. And I'm willing to even look at them in a different way. But the point is, at a foundational level, we are aware that the body is very much connected. So yeah, in a sense of something like mental illness with St. John's wort, let's talk about. So I work with people with gastrointestinal disorders. One of the common terms that people hear about is leaky gut, or a little bit more scientifically, it's intestinal permeability. And when you have that, and this is what I see a lot of times with my clients, most of them are struggling with some sort of anxiety and or depression, or both. Yeah. So, but when we talk about that, we're talking about the digestive system, and the digestive system produces a good amount of serotonin. And serotonin is a hormone that helps with your overall mood. So if your digestive system is compromised, you can see where you would not be in the best of moods, right? You have a huge nervous system within your digestive tract. So, of course, if your digestive tract is compromised, you can also experience mood imbalances or mental health disorders because your digestive tract is compromised. The mind and the gut are very much connected. So you have different, serotonin is the main one that a lot of people know about in terms of what is created within the digestive tract. But then we can go beyond that as well, because if you're constipated, for instance, you may be recycling more of your estrogen, right? And so if you have a lot of estrogen, that could also definitely aggravate the mood. And so it can go into different realms. So to say just St. John's wort, yes, St. John's wort can be very helpful, but you have to also look at why the person is depressed, why the person is anxious, what neurotransmitters or what hormones are off, or what else is going on in their own psyche that keeps them depressed. So people can be more negative in mindset. Well, where did that come from, right? And you have to essentially work to help them to rewire themselves. And that can take more than just a naturopathic doctor. I refer people all the time to mental health therapists. But then what I like to say is that I get the conversation started when it comes to mental health, especially with digestive clients, because I know more than likely they're having something else going on just besides their digestive health. And then I may put them on something. It could be St. John's wort. Just recently I used a flower essence combination that really changed the person in 2 weeks. She was very proactive about her health, but I was very pleasantly surprised to see how in 2 weeks, just the combination of flower essences really started to shift how she just overall dealt with things. So I hope that answers your question. It can go a lot of different ways beyond just St. John's wort.
That's what yeah, exactly. That was just setting you up for a nice discussion. So yeah. You took the bait.
Okay.
So
good,
it was,
good.
yeah, because, I talk about the first thing that I talk about when I start naturopathic philosophy class is I talk about the great aphorisms and they don't teach this in the other schools. They kind of do, but they don't really. I decided to put some of these in my own course. Dr. Zeff, he teaches different ways in National College, and, Dr. Sensei, the people that teach philosophy in our profession. And so I decided to talk about these great aphorisms that have been handed down by the great, great, great grandmothers and grandfathers of natural health, by the ancients. because these are ancient concepts. I mean, you look at ancient Chinese medicine and Ayurveda and the medicine from all over the place, Africa, North Africa, places in the Caribbean that I've studied. They all talk about things like chewing your food really well. Don't
Mm-hmm.
eat when you're really stressed. You are what you absorb. I mean, these are like fundamental. That's why we call them the great aphorisms that were
Mm-hmm.
handed down by, even Hippocrates and other people, but many other people, great healers.
Mm-hmm.
The Mayans, when I started studying this, I learned that the Mayans and the Aztecs also, particularly the Mayans, were very holistic in their understanding of the mind, body, and its connection to. It's almost every culture, except for Western medicine, had this great schism of thought where they didn't think the mind had anything to do with anything, and they actually carved it into a different category. You're saying the mind has a lot to do with your gut.
Oh yes, yes. I mean, and just from personal experience, before I even knew that, right, from a biochemical standpoint, I could tell because if I ate the wrong thing, and that's unique to each person's body, of course, with irritable bowel syndrome. But yeah, if I ate the wrong thing, my tolerance to stress could go down. I could be more stressed out. I could be more irritable. I could be more angry. I could be more sad. I could be more anxious, just depending on what I ate. So, fortunately for me, and I say fortunately because I realize not everybody um, has this, but it's that when I ate a food, I reacted very quickly. So I could tell where things were coming from. Um, so yeah, I mean, it's definitely something that is real. And I teach my clients how to pick up on those things for themselves as well, just because that was something that I've gone through several times over in that quest to heal. So yeah, I mean, it's definitely there. And it's something that needs to be paid attention to. The body is not a bunch of parts. It is parts, but it's part of a whole, and all of those parts can interact with each other. And I think science is showing that more and more and more. But yeah, like you said, I think almost every culture has known this. It's just that um, Western culture decided to do something different. But I think really what's happening now is that they're learning it in their own scientific way that brings more validity for for their minds. I could
Yeah,
just say it
yeah.
that way. Yeah, I mean it's like this is how I guess Western society thinks, and it's very hard for them to think outside of that. And so, I mean, but if science is proving it, then good. It just puts more validity to what has always been, and it puts more explanation, more expansion of the explanations that have always been there.
Yeah, I mean, we've been talking about probiotics for centuries. The
Hmm.
old time naturopaths were talking about these things and Metchnikoff and
Right.
so there's a whole, a tremendous amount of literature on probiotics now, whereas before, they were maybe these yogurt people and, or maybe they, you looked at these Soviet Georgian people. I remember back in the 70s, there were these commercials for yogurt companies, and they had a lot of these centenarians there that, were saying that, they achieved a big age because of eating yogurt and the bugs in the yogurt. But it didn't really percolate down until Jamie Lee Curtis became the spokesperson for one of those
Hmm.
companies. And then probiotics became like the latest fad. It's almost like, it's
Hmm.
interesting. The eclectic doctors at the turn of the last century, they made echinacea very popular in society and golden seal and things like that. And then all of a sudden that kind of died down around World War II when allopathic medicine kind of got very powerful,
Hmm.
so the political things is very fascinating and looking at the history. But so tell us a little bit about your deciding to go to Texas. What drew you to that area?
Oh, I'm from here. I grew up here. I'm
Oh,
originally
okay.
from New Orleans, but I grew up here since I was 8 years old, and I just made the decision to come back home as my first place after. after school and starting my business. And actually, Austin is more familiar with naturopathic medicine. It's a very eclectic, holistic place, if you will. It's a melting pot of different things. So, like on one hand, it's a heavy tech spot, but then on the other hand, it's very unique and very accepting of natural medicine. So most of the naturopathic doctors are actually in Austin. But since I was from Houston, I was like, you know what? I'm gonna go back to Houston. And I looked at Houston like an emerging market where they didn't know about naturopathic medicine, and I thought it would be good to introduce it because, like as you were mentioning, we are still in a quest to license naturopathic medicine across all 50 states. Right now, it's in 22 states, including the Virgin Islands and Puerto Rico. And it's something that I'm pretty sure most naturopathic physicians also want to see go global as well. So I thought it would be a good idea to expose Houston to naturopathic medicine because it spreads the word. Um, Houston does in fact have a lot of holistic practitioners of all different sorts here, but it's not per se in your face. So like when I was growing up here, I didn't really know about holistic medicine, but there's probably been people here for like, 20, 30 plus years. Now I think it's starting to be a little bit more prominent. And when I tell people, I mean, it's interesting to see the difference because when I first got here and I would say naturopathic doctor, they were like, what? Wait, what did you say? And now they're like, oh, okay. And so I see the growth that is there. And sometimes when I'm walking around and stuff, people will be like, I know you, or you look familiar. So I think it's good that I came somewhere to expose naturopathic medicine even more so that the growth of it can happen.
Now, do you find that um, you're dealing with a lot of chronic? Well, let's backtrack. So,
Hmm.
naturopathic doctors have an interesting philosophy about acute versus chronic illness, going back to Lindlar and some of the founding people of, or at least thought people
Hmm.
of the profession. What's the difference between an acute disease and a chronic disease, and how do we get all these chronic diseases that Western medicine doesn't seem to have answers for? And we'll kind of segue eventually into your real interest in kidney disease, which is fascinating. But like
Hmm.
what's your thought on all that?
So with acute illness, let's talk about fevers real quick. Um, so in allopathic or conventional modern medicine, um, the idea is if you have a fever to suppress it. But reality is with a fever, you really shouldn't suppress it to a certain degree because the fever helps in killing off whatever bug might be there. It's part of your normal immune function when you are dealing with something. It's part of what your body is using to try to get back into balance. So if you're killing that fever off, then the body doesn't have everything that it normally would have to get better more quickly. But of course, yes, at a certain point, then the fever might be going too high, right? And so naturopathic doctors learn how to deal with that, like letting it go further than probably a conventional medicine doctor would, but also knowing, okay, well, this might be going too high, right? So with acute illness, it's important to know how to deal with it so that you can get over it. But and that can include things like taking off work, going to sleep, right? Getting your fluids in, eating healthier while you're sick, because all of these things help to optimize the immune system so that it can resolve the issue. But a lot of people in America don't do these things, and that instead they do things that suppress their immune system, like still working through sickness, right? I mean, even Oprah recently said that she was like, I still work when I'm sick, and we see that as noble, and because she is where she is, it's easy to listen to that, right? But reality is, she was fortunate because there are people who do that and they end up with a chronic illness that sets them back. Actually, to recently I got a call from an entrepreneur, young in his 20s, and he uh, didn't have insurance, so he just was off of insurance for 3 years. So eventually he got back on insurance, found out he had super high blood pressure and kidney disease stage 5, and had no symptoms whatsoever, right? And one of the things that I teach people is how you can do a nice basic monitoring of your own health even without insurance. So even something simple as, if you know high blood pressure is in your family, please just check your blood pressure every once in a while. Like, don't go 3 years without doing that. But to get back to the question, if you're doing things like not taking care of your health, overworking, not sleeping, um, suppressing fevers, eating things that are not good for your health, you're suppressing your immune system. The whatever bug might be in there is going to take longer to come out. It may do more damage as it's in there, and it can create chronic illness. And so you can hear about some people getting a respiratory infection and then all of a sudden having autoimmune disease. And so, or it could be the beginning of the of an increased amount of symptoms due to autoimmune disease. And so in that sense, it could be that the body was not equipped at that time to deal with such a pathogen. And so now you have the body attacking itself, right? So sometimes this is where you can see little things can lead to big things. And so that's why I think it's really important to really address acute illness as strongly as you can, so that you can move on. So you may have 3 days off from work, right? But then you move on.
But what about the idea of symptoms being good? Like this is another big difference in conventional or allopathic medicine and naturopathic medicine. You just mentioned that, fever was a good thing. I think most folks out there are kind of in that mindset that fever is bad, being sick is bad. And you're basically saying that more acute illness is like a reset button, but then eventually, if you don't really deal with it and you keep suppressing it, it will become this chronic degenerative thing, which really isn't a good thing then at that point.
Right. I mean, I think the concept of something being bad is just people don't like to feel bad, right? I mean, in any
Mm.
sense of that word, whether it be emotional or physical or anything, and it keeps them from doing what they deem as higher priorities, such as work, making money, right? It people want to go out and go to a festival that weekend. Well, they may not be able to because they have to stay in bed. And so I think it's more about people don't like feeling bad, and being sick halts whatever other priorities you had. So it's more of that mindset versus, hey, I'm dealing. And then it's the other side of it, like, how did I get sick? Why did I get sick? Was there something I did? Is there something going around that I got from somebody else? So it's just more of a negative thing. But yeah, one way that you can change that is to look at, okay, this is what's happening. Here are the symptoms that are telling me something is happening, and now I need to deal with it. And so that's why I say I was fortunate, even with dealing with irritable bowel syndrome, that I got very quick feedback on which foods were problematic for me, and then I removed them. Whereas some people, they don't. One thing why I say I like to train my clients on how to pick up on that is because, and even in my case when it first started, when you are hit with a chronic illness, it can be a very, it's not a good feeling, because it's this, I don't know what to do. I don't know why this is happening. It can be a powerless type of feeling because you don't feel like you're in control of your health and you don't know what to do. And you're just watching your body like have all these problems. And so when I teach my clients how to pick up on things and to notice when a food creates a symptom, that is information. And so it's very empowering because now you know things that you can do to manage what's going on with yourself. You're not just in the dark at somebody else's hands who might give you something and then it may or may not work. Like, you have more power now to deal with your own health and keep moving forward in a different direction. So in that sense, symptoms, it's not fun, but you can also look at symptoms like information. And now you can do something with that information.
Okay, well, it's time for us to take a quick break and play our natural medicine chest mini modular show that will, it's only a few minutes. And then when we return, we're going to dive right into kidney disease. Very interesting stuff that Dr. Devin Miles has been working with. So stay with us, folks. We'll be right back.
On this edition of the Natural Medicine Chest, we'll take a look at the soybean, its phytochemistry, and its role as a food and medicine.
It is exciting to see a resurgence in research by universities and food scientists on the role that foods play in disease prevention. Many of these institutions, such as the United Soybean Board, the American Soybean Farmers Association, and the National Cancer Institute, are busy developing designer foods, or superfoods, concentrating the essential nutrients and phytochemicals in soybeans and other foods that have potent medicinal effects. Commonly known foods which have soy in them include soy milk, a cheese-like substance called tofu, tempeh, a fermented soy protein, and tamari, a fermented soy sauce. The soybean is a rich source of many nutrients, including selenium, zinc, beta-carotene, vitamins A, C, and E, and 20 of the 22 amino acids. Soy also contains essential fatty acids.
Research on soy foods is vast and well known to health enthusiasts, although the general public and physicians in the United States may not be aware of this plethora of research. In Japan and China, however, this is not the case, as a voluminous number of scientific studies have been carried out in animals and humans. Chinese studies reveal that soy products can increase the ability, rate of activity, and number of white blood cells. Patients receiving chemotherapy and radiation can benefit from drinking soy milk, which in several studies demonstrated a protective effect on the liver and gastrointestinal system.
It is interesting to note that the British journal Lancet revealed that vegetarians and Asians who ingest high amounts of soy have the lowest rates of cancer. This is due to one of soy's constituents called genistein. This chemical is a phytoestrogen or plant estrogen, which can decrease and block the uptake of human estrogen and testosterone, as well as enhance its excretion. Like the drug tamoxifen, it competes with estrogen for uptake in the reproductive tissues. By doing so, hormone-dependent cancers like ovarian, breast, and prostate cancers may be prevented.
In conditions where there is a deficiency of hormones, such as osteoporosis and menopause, soy isoflavones, such as genistein, can weakly mimic estrogen and reduce the severity of these problems.
So, listeners, don't count out the versatile soybean. Make it a delicious and nutritious part of your natural medicine chest.
Dr. Miles and Devin Miles, and she's a naturopathic physician, and she's the owner of It's Time Natural Health in Houston, Texas, and graduate of the Southwest College of Naturopathic Medicine. So, well, let's talk about the kidneys. Now, it's interesting because I also teach urology and nephrology at the college, and so I spend, unfortunately, it's such a compact class. I wish I could spend more time on kidney health, but this is something that's really ravaging Americans. We're going to move into kidney problems now. So I was mentioning that I teach nephrology and
I'm back. Yeah, can you hear me?
Yeah, I can hear you.
Okay, great.
Good. And so I teach a lot on the kidneys, but not enough. I'm saying that it's a really real problem with people because the kidneys sort of become the repository of a lot of toxic lifestyle that people like. I didn't know that Roundup and a lot of these toxins can injure the kidneys until I started researching. Corn, for instance, GMO corn can injure the kidneys. Many Artificial sweeteners can injure the kidneys. High blood pressure can injure the kidneys. High blood sugar, I think those are the number one and two reasons for why people have kidney failure. All so this is interesting that you got into kidney health. How'd you manage to get into that, Dr. Miles?
Well, it's funny you said you were a urology and nephrology teacher. Of course, we had one as well at Southwest College of Naturopathic Medicine in Arizona, and he was suggesting that to the students because not too many people were going into naturopathic nephrology. So at the time, I was thinking about what I really wanted to focus on. And so when he said that, I was just like, okay, yeah. And I also happen to have a father who has kidney disease. So I have an incentive to help heal him and to help heal others. And so I decided to take this on just because it was like something unique, and I just wanted to learn more about it. And I'm glad I did because it's more like again, kind of going back to the powerlessness versus empowerment. I now know that there's things that can be done instead of just playing the waiting game towards dialysis. And that is going back to the hope that I have in general about the body, is that the body, if you give it what it needs, it can heal, even in situations where we don't think that that's possible. You can still see some improvement. And so I'm very glad that I went into kidney disease for that reason.
So what are the big reasons for why the kidneys fail? And then let's just talk about talk about what the kidneys do, because they don't only filter the blood, they're responsible for so many interesting things that you don't really realize until you start reading about nephrology.
Mm-hmm. So yes, it does help to remove waste from the body. There's different ways that the body removes waste. So of course, the skin, the bowels, when you exhale, right? So you have what's called these different emunctories in terms of how we remove waste, and the kidneys are part of that process. So they also help to remove drugs from the body. They help to balance the fluids within the body. They help to balance the electrolytes within the body. Some things get reabsorbed, some things get filtered out within the kidneys. And they also help to release hormones that regulate blood pressure. The arteries that are near the kidneys also help to regulate blood pressure in that way. So if you have a constricted artery around the kidneys, of course, that could increase the blood pressure. So when you're looking at high blood pressure, you have to figure out where it's coming from. And so it could be more of a cardiovascular issue, or it could be a kidney issue. So you have to figure out which one. Kidneys help to produce an active form of vitamin D, and that, of course, helps to promote strong, healthy bones. So that's why in kidney disease also you may see medical doctors provide their patients with vitamin D as well. And then it helps to also control the production of red blood cells. And so another thing that might be given in the midst of kidney disease is erythropoietin, because the kidneys are compromised in that way. So there's different, per se, troubleshooting issues that have to happen when you have kidney disease or dialysis, or you're on dialysis, excuse me.
Right. Plus, your diet has to change depending upon what stage of kidney disease, and your water intake.
Yes.
And sodium, potassium, and protein. So talk a little bit about kind of what happens as people go from the early kidney disease, and then how that's picked up maybe on a blood test or something.
Right. So to start, when you are diagnosed with kidney disease, they're looking at 3 particular lab markers on your comprehensive metabolic panel, or otherwise known as the CMP. It's usually part of routine blood work. I have seen some doctors only do part of the metabolic panel versus a complete, but usually it's GFR, which is glomerular filtration rate, blood urea nitrogen, which are also known as BUN, and serum creatinine. The glomerular filtration rate is the main number that is used to diagnose and stage where you are with kidney disease. So that is what is first looked at, and then um, the electrolytes on the CMP are also looked at, because as the kidneys become more and more compromised, going back to the electrolytes, and when we're talking about electrolytes, we're talking about certain minerals. So those minerals, as I mentioned before, some minerals get reabsorbed by the kidneys and some get filtered out. If the glomerular filtration rate has been compromised, meaning that the kidneys do not filter as well as they should, then you can get a buildup of these minerals in the blood. So that could be problematic for a number of different reasons. So that's why, for instance, if you could start having too much potassium in the blood, or you could start having too much phosphorus in the blood. So if that is the case, then a renal dietitian, and when I say renal, I mean kidney, they will put you on a low phosphorus diet, right? So you have to regulate how much of these particular minerals you start to take in, because you cannot filter them out as well anymore. So
Right.
yeah, that's why it can get more and more difficult as time goes on. And so that's why I'm a huge advocate of trying to prevent kidney disease in the first place, because it's it can be, kind of tedious after a while. You really, like, in naturopathic medicine, you have to watch your diet anyway. In kidney disease, you really have to watch it.
Yeah, and I learned through, one of my students is also well known in the kidney field, Dr. Jenna Henderson,
Hmm.
and she presented at the AANP conference, and she was talking about that quinoa can be not good for the kidneys when you're in kidney failure or entering that stage, because it's very high in phosphorus. So these foods that we consider pretty healthy foods can
Hmm.
be not so great for the kidneys as things progress. So I like your idea of prevention is really one of the main things. And so, what's the number one reason why people get kidney failure?
So the top two reasons really in America are diabetes at 38% and hypertension at 26%.
Right.
So those are like two areas that I tend to talk to people about, because when you're dealing with those conditions, I don't think enough is said in terms of kidney protection, because you're just dealing with the diabetes, right? You're just dealing with the hypertension. And so it may be talked about a little bit, but I don't think it's talked about enough, given that there's a good amount of people who don't have well-controlled blood sugar, even though they're on medication, who don't have well-controlled blood pressure, even though they're on medication. And when you get into those fluctuations versus normalized blood pressure, normalized blood sugar, that fluctuation, not just that it's high, but the fluctuation can cause problems for the kidneys as well. And so that's something that I try to make sure I tell people, like, look, you have to get it normalized.
Yeah, yeah,
And it's not okay either.
exactly.
Yeah.
That's the
So
thing that's the thing that's so tough, but it's very easy too, in a way, because now everyone can have a glucometer, everyone can get a blood pressure, and you get immediate feedback looking at foods that spike your blood sugar, times of the day that your sugar might be high. Like, I've been having a rash of patients that their blood sugar is very high in the morning versus at night, and I think that has to do with probably the hormone cortisol and things like that. So I treat them a little bit differently from, say, like another type of person with either metabolic syndrome, which is pre-diabetes, or the march towards diabetes, or diabetes itself. So
mhm.
that's why it's nice to tailor the treatments to the patients, like you were saying.
Right, right. And honestly, when people come in for just diabetes or just hypertension, I'm protecting their kidneys right then and there. I'm not waiting for them to get kidney disease. I'm telling them right then and there, like, look, this is what you need to look at to monitor your kidneys, and here's something that can help to protect your kidneys. So I get the conversation started, because what I find happens for the people who do call me for kidney disease specifically is that they had no clue that they had it. And when they found out, they were at stage 4, stage 5 already. So there's
Mm.
this disconnect between the physicians and um, and the patients. because, and some of the things that I think are happening is that, and this is what I love about naturopathic medicine. In conventional medicine, there's no stopping progression of kidney disease. Medications can help to manage the rate a little bit, but it's not, they don't see the kidneys as something that can regenerate like the liver does. Once the kidneys are damaged, they're damaged. And so the best you can do is prevent them from being further damaged, right? But once the kidney is damaged, you can just overall continue to progress to kidney disease. And so that's the mindset within conventional medicine. And so what happens is that you have different thoughts about the GFR. So the glomerular filtration rate, or GFR, if it is above 60, depending on your age, especially if you're older in age, that can be considered normal. But it's like once you drop down below 60, it's like you're already in stage 3, because technically GFR below 90, you're starting to get into the beginning stages of kidney disease. And so I think that disconnect might be there. And so you have to look at that number in conjunction with everything else, right? But then the other side of it is that when they're in stage 1, stage 2, stage 3, I think what the patients are interpreting and gaining from the doctors, oh, you're okay, it's not that bad. It's more kind of downplayed. And then when you get at stage 4, it's like, hey, you got kidney disease, got to think about dialysis soon. And so I think it's very alarming to people, because I try to say, hey, come to me early, because a lot of people who do come are already at late stage. And so that is why I've also taken upon myself to start educating people about kidney disease, and people who have different conditions that could put them at risk for kidney disease. I'm talking to them about their kidneys, even at that point.
And so the best thing to do is, of course, come consult with a naturopath and keep an eye on that GFR. Now, a lot of the lab tests, when they run the GFR, they just tell you that you're greater than 60. So there's a more specific test that you could run that actually gives you the frank number, the real number, like, is it 90 or how high above 60 is it, right? So I think that's an important way to monitor your kidney health. And then what about nutrients that help the kidneys? We're trained as naturopathic doctors to understand nutrition and how it helps the kidneys. And there's a whole array of nutrients that helps the kidneys, which they say are probably one of the most metabolically active organs in the body.
So in terms of nutrients, where I really tend to focus for the kidneys is antioxidants. That was the main theme that I learned when I was learning about kidney disease from a naturopathic perspective, is that antioxidants will help to protect the kidneys, and lowering inflammation helps to protect the kidneys. If you have a lot of inflammation, you can have a lot of free radicals. And if you have free radicals, you can have more inflammation. So they feed each other. So this is why it's also important to increase the antioxidant count. And you could do that through a lot of different ways, such as like pomegranate juice, right? Or a lot of different, all these various foods that we know are very high in antioxidants. But it's a matter of increasing the antioxidant count, which you can also do through herbs, as well as reducing the inflammation that's going on in the body. And so from that perspective, it's also important to know why you got kidney disease in the first place. Was it diabetes? Was it hypertension? Was it lupus? Where did it come from? So that you can get to the source of where the inflammation, what the inflammation is, and reduce that. So that's, in terms of nutrients, that's really where I focus on, is improving the antioxidants and just getting them on a diet that is going to be helpful for overall kidney health and prevention of worsening kidney health. So of course, with protein, you have to be careful about how much you're taking in. So if you just have somebody who's coming in and they eat meat all the time, well, that's not going to work. They can still, depending on where they are, they may still be able to have some meat, but it's going to have to get significantly reduced, particularly with animal protein. But then, of course, then you get to introduce them to all these different varieties of foods that they've probably never eaten before or probably just had in minimal amounts. And so when you do that, you increase their overall health, right? So that's the main nutrients that I tend to focus on. Of course, vitamin D is going to be helpful just because the kidneys are compromised and you still need the vitamin D. And then, of course, it can also depend on, like if you have kidney stones, for instance, then something like magnesium might be helpful to help with increasing the solubility of different contents that are filtering through the kidney so they don't become crystallized.
Right. Yeah. Kidney disease is complex. There's a lot of things that we have to think about to help them. Diet, lifestyle, drinking water too. Water is so important for kidney health. I mean, there is a stage when water won't really help the kidneys, kind of like, when you're on dialysis at that point, it's probably not a great idea to be drinking a lot of water. But I think up to most of the cases, water is super important, and staying away from sugar. You were talking about meat, and I was thinking Texas barbecue. And what does barbecuing do to the meat that makes it even more toxic? I think that's I've read something about that the cooking process makes it, with a sweet sauce, makes it kind of even more delicious for some people, I guess, but is a disaster when it comes to the kidneys, particularly if you're living on that stuff.
Yeah, I mean, of course, if it's charred, if it's burnt, that's also been linked to being carcinogenic as well. So I can say from being in Texas, there are some people who barbecue very bad, and then there's some in terms of like it's burnt, it's dry, you don't want to eat it anyway. And then there's those who know how to slow cook barbecue. And so slow cooking is something that, of course, has been done for a very long time. Not that I'm advocating for barbecue, but there's different. It's not something I eat every day. And I, as a Texan, I could tell you not everybody eats that every day. It might just depend on what part of Texas you're in, or what part of even Houston you're in. But yeah, I mean, I've probably had barbecue maybe once this year. So, and I made it. So it was different. But yeah, I mean, definitely in the South, we have a lot of work to do for a lot of people because our diets are very conducive to poor health in general. So yeah, it's prominent here, but it's more like what the place is known for, but not so much what people eat on a consistent basis. But like one particular food that can be helpful for the kidneys is flax seeds. So there was a study done where patients were given 15, 30, and 45 grams of flaxseed daily, and what was found was that 30 grams of flaxseed per day was well tolerated, and it helped to reduce total and LDL cholesterol, reduce platelet aggregation, helped to reduce serum creatinine, which is one of the markers I mentioned before, helped to reduce protein in the urine, as well as complement C3. So this could be helpful in terms of when I talk about complement C3, this could be something that can be helpful in lupus, right? So lupus is another condition that, if you're inflamed, it's going to make that condition worse. And so flaxseed is helpful for not only improving the kidney function, but also helping to reduce inflammation. It also contains omega-3s, so we know that helps with inflammation and helps to reduce complement C3. So there's a lot of different
and
foods.
Buckwheat too. Buckwheat is something that I was researching for my class and teaching about, power foods for kidney health, and found some interesting information on buckwheat. And it's interesting that buckwheat's in the same family as like some of these amazing kidney tonics that the Chinese have used in Ayurveda for, gazillion years. And it's so interesting that the buckwheat is a good alternative food for kidneys, particularly people who can't get away from wheat and things like that. So I found that's my contribution to the conversation on food for the kidneys there.
Thank
flax
you.
seeds. Yeah, I had a very interesting case that I just presented at the Restorative Medicine Conference in San Diego just this past September, where I talked about a woman with lupus and showed the numbers of her kidney function over. I've been working with her for about 7 years. Totally. I mean, they wanted to put her on CellCept, which is a very strong B cell depleter, for lupus, nephritis, and she doesn't have it anymore. She's been free of this for 5 years now. So you can do miraculous things with naturopathic medicine. So how could folks, we're running out of time here, how could folks get in contact with you?
So I do telehealth consultations, so people can really see me from almost anywhere. And you can find me on drdevinmiles.com. Devin is spelled with an I, as well as on social media, Facebook and Instagram, and Twitter. All three of those are at Dr. Devin Miles. And you can also call me, 281-231-2811.
Dr. Miles, it's been such a great discussion talking about naturopathic philosophy and our training and how we look at disease and all the work you're doing out there. And you are definitely a pioneer in Texas there. So we're really happy that you're part of our profession. And thanks so much for joining us here at The Natural Nurse and Dr. Z.
Thank you, Dr. Z. I appreciate you having me. It's a good conversation.
Yes, and I hope to meet you at a conference one day.
Yeah, it'd be great to meet you. All right, you take care.
You take care. And that does it for another edition of The Natural Nurse and Dr. Z. Remember, health is wealth, so stay healthy, folks. Bye-bye till we see you again.